Okay, so we're going to talk about doing oral cares for mechanically ventilated patients that are intubated. We're going to do these cares to help prevent any ventilator-acquired pneumonia from happening with these patients. So we do these oral cares every 2 hours to help prevent that. So the first thing we need to do is not enter the room, wash our hands, and introduce ourselves. And then we need to apply the appropriate PPE. Once we've done that, we'll check the ET tube for any damage, and then we'll go ahead and begin. So we want to make sure we always have gloves on, and then other PPE as appropriate. So we're going to go ahead and attach the suction to our little suction handle at -100 to -120. And the first thing we're going to do is attach the Yankauer type suction catheter. This is what's going to help us get those secretions that are just kind of sitting in the patient's mouth. We're able to sort of go around the ET tube, but that's what's going to help us really get what's just sort of sitting in the mouth. This protective sheath is just to sort of help keep it as clean as possible. So we come back after 2 hours, then we're going to use this toothbrush attachment. It attaches right into here. I don't have it, but that's where it goes. And you're going to apply a type of toothpaste. You're going to brush the teeth. You want to make sure you're brushing all the teeth, all surfaces of the teeth, and you want to make sure that you are being thorough enough that the mouth is being cleaned, but not too rough where you're causing pain for your patient. Once you have all those teeth nice and clean, you can turn on the suction and suck out any of those secretions that may be residing in the mouth. And then you're going to apply this mouth moisturizer to the cheeks, the roof of the mouth, the tongue, the gum line, those internal surfaces of the mouth. So then you come back 2 hours later. We're going to use this suction catheter. You can see it's considerably longer than the Yankauer catheter. This is what's going to get those secretions that are sitting sort of farther back into the throat. With patients that are on the ventilator, they can't cough that up by themselves. So it's our responsibility to get that out of there for them and keep that mouth clean. So we'll use this device to do that. Then we come back 2 hours, time to do oral cares again. We're going to apply this kind of bent sponge type of cleaner. This is very similar to the toothbrush, so we're going to dip it in this oral debriding agent, a lot like mouthwash, and we're going to clean all the surfaces of the mouth again. You want to make sure, just like before, that you're not being too rough or too gentle. You want to get the mouth clean, but you don't want to hurt the patient. So once you've done that and cleaned the surfaces of the mouth again, turn on that suction, get those secretions sucked out of there, and then before you leave the patient, make sure that you've moisturized their mouth, including their lips and the internal surfaces of the mouth. You want to make sure that the patient's mouth is always well moisturized. And then before you leave, you can reassess that patient, including assessment of the ET tube. You want to make sure there's no damage, and you want to check the integrity of that patient's skin where the ET tube has been sitting. So this is how and why we do oral cares for these mechanically ventilated patients.